spreading the message of disinformation to ordinary people who have no bearing, no idea on how to make a judgment on what's real and what's not. If you don't understand the system because you work in it, not having worked in it, then you're liable to fall prey to these lies. The propaganda system in this country is literally the most sophisticated in the history of the planet. And people's minds are being manipulated through no fault of their own by this ingenious collaboration between the media working on behalf of corporate America, because it is part of corporate America, in order to ensure those profits and not disrupting the cash flow that the insurance companies have come to expect and do not want to be disturbed. How obscene is this? The CEO of United Healthcare, his hourly wage, $102,000 per hour. $102,000 per hour. Now, we are divided by our party affiliations. That's purposeful, because if you're on a team, it's much easier to divide people if they're not thinking about the issues, but merely siding with their team. We are encouraging people to think independently. Think about the issues. If you're troubled with what's going on, you need to not just follow along, because that's what they want you to do, the they being the establishment, the corporate establishment and those associated therewith. It is this paradigm that we wish to break through such things as public campaign financing. The real problem here is how we elect our officials. It's those checks that I'm talking about, the checkbook. America is ruled by a pen and a checkbook, not the point of a gun. That's where we are, and nowhere has this been more graphically demonstrated than through this faux debate on health care, because it's not really a debate. It is not a debate. It is really a false representation of debate. It's about certain people speaking out against and certain people speaking for, but in the end they're taking those campaign checks from the same lobbyists. Look at Max Baucus. Why is he in charge? He's totally bought and paid for. He's collected over $2 million from the insurance industry alone. This is, on its face, it's ridiculous, but you have to pay such close attention to this, and most of the public is working so hard just to make ends meet, especially at this point in our economic history, that you can't possibly expect everyone to pay attention. So instead, they see these commercials on TV, very well and carefully constructed commercials on TV. You hear the pundits who you've come to know and trust as authority figures. You see the president, whose own discourse has morphed from health care reform to health insurance reform, right along with those commercials. I'm expecting not a big change in the president's behavior on Wednesday night. He has 48 hours to collect himself, to decide whether he's going to be for the people or for this corporate paradigm that I'm talking about. You saw in the elections that happened, the primary elections running up to the general election, how many candidates did they have on the Democratic side? At least 9, I think. All meant to diminish the power of the one man who actually had a plan that said how. That man was John Edwards. We saw what happened to him. Some of it through his own doing, but not without being thrown the bait. Remember that John Edwards stood up in front of America in those debates and said, it's pure fantasy to think that you're going to negotiate with the insurance industry. You must defeat them. I know how to defeat them, and he was promptly cast aside, put out to the outside on the debates, heard little from, purposeful camera angles. It gets very sophisticated, but when you watch it as closely as I do, you see what happens. So we are asking President Obama to stand up and provide leadership on Wednesday night. The kind of leadership on this issue that is required to move the nation in order to move the Congress despite those campaign contributions. I don't know what else I can say other than the fact that this is what it is. This is where we are, and the only question is where we're going to end up. And if you'd like more information, I'm not running for Congress this election cycle because of the well-known fact of gerrymandering. But I stand wholly in favor of Medicare for all, which by any measure, no matter what variables you put in the equation, is the most cost-effective way to bring quality, affordable, comprehensive health care to America's citizens, and to be wise in our policy that will help our economy and help to raise people up across every income level in this country, make our country more productive and more competitive globally. It's the only way we can do it, folks, and I hope you've been able to gain something from my message. If you have any questions, I'll certainly be available to speak with people for a while here. I thank you very much for your attention. More information can be obtained by going to my website, which is johnrussell4congress.com. I'm looking forward to my friend Mark Adams coming up here and giving his points of reference. He was my attorney in our election contest in 2006, where we had evidence that the votes weren't counted properly, and of course this melds into the whole thing that we're talking about here. Thank you very much.
Thank you, John. My name is Rob Field. I'm here with Volusia Progressives. I want to thank John for talking about single-payer health care. I've got some information here about single-payer health care. Our table is back here in the back left corner. We've got some information about a bill currently on the Hill to try to put single-payer back in the debate. This bill needs your support. Please go to the back table, get some information about it, contact your congressperson, and let them know about this issue. Thank you.
In the event that the president fails us on Wednesday night by presenting some Baucus, Grassley type plan, he will go down in history as the great Capitulator. He will be a one-term president if he doesn't come through appropriately on the issue of providing the American people a viable, comprehensive, affordable public option.